Hi, everyone. I'm Jeanne Meserve. Thanks for joining us for the Water Summit. We're so glad that so many of you have joined us from all across the country to join in this conversation. 71% of the Earth's surface is covered by water, most of it oceans, but the oceans are facing some challenges. One, climate change is rising sea levels, and secondly, pollution. Those two things in combination are creating an environmental and public health crisis. But that's not all. There's also a crisis when it comes to drinking water. An estimated 2 million Americans do not have consistent access to clean drinking water. And think of that in the time of COVID, when one of the principal public health recommendations is that we all wash our hands. Those are the topics we're going to be discussing here today. We're going to be talking about why these problems exist, who's affected by them, and what we can do about it. And towards the back part of the conversation, we're going to be talking to two leading oceanographers about specifically what they are trying to do to save or improve the world's oceans. Before we go any further, just a couple of words to thank our sponsors. A thank you to Tide and Cascade for sponsoring the Atlantic's journalism. We do, of course, want to hear from you. We want you to participate in our conversation today. You will see a Q&A button at the bottom of your screen. Use that to submit your questions. If you could please keep them short, keep them sweet, keep them on topic, and tell us where you are watching from. That will be great. We will get to as many of those as we possibly can. And now let's jump in. Our first guest is Marc Edwards. Marc is a civil engineer at Virginia Tech. He was one of the leading scientists who uncovered the water crisis in Flint, Michigan, and he's recently been focused on why the pandemic makes the need for clean water that much more important. Marc, thanks so much for joining us here today. Great to have you with us.
Thank you for having me.
So first, let's talk, if we could, about this intersection of clean water and COVID-19. You've described it as a catch-22. What do you mean?
Well, I think that our grand challenge of water in the 21st century has always been a kind of complicated nexus of access, affordability, sustainability, hygiene, comfort, and control of waterborne disease that really affects every American. And your subsequent speakers are going to address each of these important topics. But, you know, many of us really do take clean water and modern plumbing for granted. And for most of us, it's only when these systems do not work, they fail, and we realize that without a means of bringing clean water into our homes and communities and transporting waste away, that modern civilization does not exist. And so, you know, let's remember from whence we came and, you know, where some Americans find themselves now. It's just this last century where we've really wiped out the scourge of waterborne disease that were attributable to fecal contamination of water supplies. And for a privileged majority, that's no longer an issue. And, you know, our water industry does a really, really good job of providing pretty high quality water for extremely low prices. And the cost—
But not everybody has it, right? 2 million Americans?
Yeah, generally at a third of the cost of our cable bill, but millions of Americans do not have access to that. They're not part of that privileged majority. And when you're in a pandemic, you realize just how important it is to have access to basic hygiene that is so critical.
Is hand sanitizer an adequate substitute for running water in this situation?
Well, it's a start, it's a substitute, but it's not as good as having an ability to a warm water bath and, you know, regular comforting showers and with all the hygiene benefits that go along with that. And so if you have millions of Americans that either have had their water shut off or never had access to that modern plumbing convenience in the first place, of course, they're at risk. And you know, the water poverty that you see in these cases, again, it shocks the conscience. And to some extent, even if we're just looking at this from a selfish perspective, it affects all of us, because you're not only judged by how you treat your most vulnerable, but all of us are at risk from the behaviors of everyone else.
You mentioned in your first comments waterborne diseases. Is there any indication that COVID-19 is spread through water?
Not so much. The water is disinfected. It's very good at getting rid of viruses. And so I think our water systems can be viewed largely as a protector, wherein just regular hygiene is going to help reduce the overall significance, just like all the other distancing, social distancing, and mask wearing that's going to have to be part of our response.
How do we find ourselves in a situation where this many Americans do not have access to water or to clean water?
To some extent, it reflects the fact that our job was ended incomplete, wherein, again, the vast majority of Americans did benefit either through having an adequate private well or being part of a regulated public water supply. But there's always been, we did get it down to the point, there's been about 2 million Americans or so who don't have access to the plumbing. And then there's really the growing problem that, in fact, is the key driver behind Flint and what occurred in Denmark, South Carolina, and other places around the country, where a lot of our poor red rural communities or blue post-industrial cities are losing population. They simply don't have enough money to follow federal safe drinking water law, and that puts them in the uncomfortable and unconscionable position of telling their consumers that their water is safe when it's not. And so in those communities that they can't afford their existing water system, the likelihood of shutoff for those who cannot afford to pay is very high. And of course, once that happens, if it happens, they're in the exact same position as all those folks who never had access to modern plumbing and modern clean water in the first place.
The American Society of Civil Engineers rated America's water infrastructure as getting a D, and the estimates of how much it's going to cost to upgrade that infrastructure, the numbers are just startling. In a time of budgetary stress, stressed additionally by COVID, what's the likelihood that we're going to see the kind of investment in water infrastructure that's needed to address the problem?
You know, it's really unfortunate these water systems are out of sight and out of mind, because if people saw what these pipes look like and how much waste and water was lost through them, we would fix this problem in a second. I mean, you see the problems with the roads. If a bridge collapses or your car hits a pothole, but you don't really see the disease or the loss of money that's occurring through these leaky, old, antiquated pipes. You don't really see the consequences of elevated lead in the water or Legionella unless there's a disaster like Flint where it's brought to the public attention. So, you know, because there's never a ribbon cutting ceremony when you replace an old rusty water line or a lead pipe, we tend to fix those things that are visible. And unfortunately, you know, for that reason, we fix on failure. We fix when we have no choice, when the water main actually breaks. And this is the least cost-effective way of dealing with the problem. And unfortunately, once you're in that mindset, especially, you know, in our poorer communities, you know, you're wasting money, but that's how you roll, and it's hard to get out of that fix on failure mentality.
I've even heard that in at least one major American city, there are still wooden water pipes in use. That's how old some of the infrastructure is. And I've seen an estimate that it's going to take $1 trillion of investment over the next 25 years to upgrade things to where they should be. It's not going to happen, is it?
It will happen, but it will happen after all these pipes break and you have no choice but to fix it, or else you go without the water. And so even though, again, that's least cost effective, that is our modus operandi, and I wish it would change, but it will happen.
Let's talk about Flint. You were intimately involved in the exposure of what was happening there. What's the status of the water supply in Flint now, all these years later?
Well, the water has been meeting federal safety standards now for lead and other issues for about 3.5 years. But there's widespread deserved distrust about the water. There's still a dependence on bottled water because of the justifiable fear there's still a fear of the water for bathing because the disease Legionella, which is a disease of modern plumbing where these bacteria grow in your buildings, killed 13 people, and there were fears of other bacteria in the water as well. So it's really a sad story, and it just illustrates once the trust is lost, even with hundreds of millions of dollars of external money, it's not easily regained.
So in Flint, the threat was lead. There are many other threats to water supplies in different locations, aren't there?
Yes, and actually the most underestimated danger in Flint was bacteria, Legionella. It was one of the largest per population outbreaks of Legionnaire's disease in U.S. history, with 13 deaths, and probably hundreds of more people were ill from it. So yeah, this is an emerging problem that we're trying to deal with, whereas lead is one of the older problems. It's a legacy of bad decisions made oftentimes more than 100 years ago. And we're trying to deal with both of those, as well as a lot of other worthy goals that we have for improving water quality and access and affordability in the U.S.
Mercury, arsenic, forever chemicals, those are some of the other things. Sewage, right?
That's all on the list, and sewage has always been foremost on our concerns.
Are there technical solutions to some of these problems? For instance, a new filtration system that takes care of things in a way that existing filtration systems don't?
Yes, while nothing's perfect, we do have filters that are available to remove the lead at the point of use. We do have treatment systems that can be employed at the water treatment plant and in the homes to improve the microbiological safety of the water. So the issue really comes down to how much do you want to pay? And the other big issue is, do we have a shared common good approach, or is it an every person for themselves approach? And what I mean by that is, in the aftermath of Flint, many of our poorest Americans, in justifiable fear that they are next, they're spending an inordinate amount of their budget on buying bottled water or home treatment systems to protect themselves. And if that money were used and were instead spent at the water treatment plant to improve the quality of water and safety for everybody, we would all have access to cheaper, higher quality water. But there is not a sense of investing for the common good. And unfortunately, we are devolving into an every person for themselves. I will protect myself and my home using my fancy water treatment system, regardless of how screwed up my city may or may not be. And in most cases, the cities are doing a fine job, but once the fear is out there, once you've gone beyond a few bad apples and you realize it's not just Flint, but it's other cities as well, everyone starts to live in fear that they might be next.
Marc, you put a lot on the line professionally to expose what was happening in Flint. Have you tried to get access to other communities to do testing? Have you been able to do it?
Oh yes, at any time we're probably working with a half dozen communities, and you don't hear about them because we generally show that the fears are not justified, that in fact the city is doing their job and doing it quite well. And at least based on our ability to do the testing, they are not living the next Flint. But on the other hand, we've shown in too many communities that the laws, in fact, are being broken, and the cities cannot afford to fix the problems that they have. And then you're in an awkward position. What do you do? Because in Flint, hundreds of millions were mobilized to provide relief, to help replace the lead pipes. And without a highly publicized disaster in which there's government culpability for what occurred, you don't have the deep pockets to get the system fixed. And so you really have to be careful about what you find and how you approach it, because again, these systems are financially strapped, and we don't have a system for getting them money to help them follow federal law without a federal disaster declaration.
Let me ask you about federal law for just a second. The Trump administration has moved to weaken the Clean Water Act and make changes to the National Environmental Policy Act. What do you believe the impact will be on drinking water of those changes?
Well, I think it's just, really a continuation of what we've seen for decades. And again, these pipes are out of sight, out of mind, and unless there's a disaster or they fail, people tend to forget and move it down to the priority list. And we're always talking about it, and rightly so. There's something else of higher priority. It seems like it's in the news, but this corruption and this corrosion of our water system really does undermine a key founding pillar of our civilization. And once trust in that is lost, it's very tragic.
We do have a question from one of our viewers. Rick Bacon asked, do your 2 million who do not have access to safe drinking water include those not in a community or public water systems, for example, Native nations?
Yes.
It does, that number does. Okay.
Yes.
Couple of other questions here. Look like several of them are about oceans, but here's one from Pavan. Pavan, I'm not even going to try to pronounce the last name. I'm sorry, but it's too much of a challenge for me here. Pavan asked, the nation is facing $1 trillion infrastructure backlog for drinking water and wastewater. What are the strategies to make this a national priority?
I don't know, because, if Flint didn't cause it to occur, then I really wonder what will. And so, what I'm now in a mindset of is, how do you manage decline? How do you manage the fact that these cities that can't afford to meet federal law, that can't afford to upgrade their systems to meet modern standards, how do you deal with their decline? Are they destined to just become ghost towns? If so, what do you tell people who are left in those situations and who have to deal with it? My first rule is you should not be telling people that their water is safe when it's not. And following that rule gets you in all kinds of trouble. We could get out of it through a national program of investment in infrastructure and look at water as a human right. But we're not there now, and I'm doubtful that we'll ever be there.
We hate to leave on that grim a note, so let me ask you to empower the audience. Are there things that we can do, each of us who are listening to you, watching you here today, that might help address the issue?
Sure, all these problems are solvable. There are technical solutions, and we are going to pay for it one way or another. The only question is whether we do it in a smart, proactive way where we invest in for the common good, or whether we have an every person for themselves mentality and people start installing home treatment systems and wasting their money on bottled water.
And Marc Edwards, we're going to have to leave it there. Thank you so much for joining us here today with your experience and your insight. Appreciate it.
Thank you for having me.